So good morning, good afternoon, good evening from wherever you are joining us from. We thank you for joining. I know we do have somebody who popped in and said they're here from Spain. So thanks for joining us. So today we have a topic on hormones, and as most of you know, through the Canadian Association of Clinical Thermography and Dr. Alexander Mostovoy, we are hosting these monthly sessions. And the feedback has been phenomenal. We plan on continuing these. And today, again, the topic is on hormones and thermography. So we're going to go ahead and get started because I know it's going to be a jammed-packed full hour. But before we do that, I would like to just take a minute. Oops, sorry. And introduce Dr. Mostovoy for those of you who may be joining us for the very first time. So Dr. Alexander Mostovoy, he's a distinguished clinician, author, and researcher. He's also acknowledged for his unparalleled contributions to breast health, cancer prevention, and clinical thermography. With over 20 years' experience in homeopathic medicine, he's been exclusively focused on medical thermography since 2016. He's also shared his expertise, providing lectures across Canada, the US, South America, and Europe, and training numerous professionals on breast cancer prevention and thermographic techniques. Among many of his accomplishments, and we could go on here, I'm sure, for an hour, but Dr. Mostovoy is also the best-selling author of Breast Cancer is a Preventable Disease. You can purchase that on Amazon if you wish, and was also instrumental in orchestrating the 2016 Breast Cancer Prevention Global Virtual Conference, which got the attention of over 5,000 international participants. Professionally, he has pioneered and directed an integrative health clinic in Toronto where he introduced the innovative breast thermography method. He's also the visionary founder and CEO of Thermography Clinic, Inc. He expanded the venture to over 30 global locations, serving more than 60,000 women. And I'm very proud to say that Thermography Clinic New Brunswick works with Dr. Alexander Mostovoy and is a part of his team. So with that, with further ado, Dr. Mostovoy, I will turn it over to you.
Thank you, Catherine. When we decided to do hormones and thermography, I realized one thing, that we're not going to be really talking about hormones. We're going to be talking about how hormones are affected and how thermography can see that effect or visualize that effect. So if anyone is interested in having a lecture on hormones, I'd be happy to prepare a lecture because it's something that's near and dear to my heart. And I actually wanted to dedicate this particular webinar to my old friend, Dr. Alvin Peddle, who has been not only a good friend, but also a mentor for many years. I've learned everything I know about hormones from him. And he recently had some health issues. Luckily, he is recovering very well. So I wanted to dedicate this to him personally and to his recovery. So without further ado, as I mentioned, we are going to be talking more about thermal imaging vis-a-vis hormones than hormones per se. So welcome to the warmth within, because naturally, as we're talking about thermal imaging, we're going to be talking about something that relates to temperature and temperature regulation. Here you will see a couple of images on your right side of the screen. And just to give you an idea, what is it that you're looking at? So darker colors are cooler temperatures and lighter colors are warmer temperatures. So what you're looking at is a color scale. The spectrum, as we call it, will be displayed, and the spectrum or different colors, I should say, will be affected by either cool or warm, but they're going to be affected by hormone secretions. For instance, we know that thyroid is going to be affecting one's temperature, adrenal glands, and this basically is going to be um, observed with the influence of hormones based on our body regulatory systems. So the way we're using thermography, as everyone knows, it's a non-invasive thing. We're not looking through, like, for instance, an X-ray. We're looking at. So I've always joked around with patients that come to our clinic. For a change, they're radiating us instead of the other way around. Here you are looking at basically a digital illustration with thermal imaging in action. So again, you're looking at different color scale where lighter colors are warmer temperatures, cooler colors are cooler temperatures naturally. Um, just to kind of go back, and I would have to excuse myself, as you can hear, I'm a little hoarse because I'm a little under the weather, but we didn't want to postpone like we did last month so you'll have to bear with slightly lower than usual energy and a hoarse voice. Let's go back and talk about a little bit about thermal imaging, how the genesis of thermal imaging, if you wish. First, it captures radiations that naturally emits from one's skin. It started more or less in the 40s in the use of military applications of thermal imaging, which was classified. But the first thermal imaging study that was published was actually in Montreal, of all places, in McGill Medical School by a physician by the name of Ray Lawson, who published a study on breast thermography per se in 1956. Then it was later adapted in 1960s in the United States, specifically in New York. So medical infrared thermography is basically a non-invasive diagnostic tool that's looking at physiological function. And that's something that naturally attracted myself and many others who are involved with thermography, because we are looking at physiological changes. What does that mean? It means that physiology will always precede anatomical or structural changes. So before anything grows, there has to be a change on the cellular level, and that change on the cellular level is going to be affected by thermal regulation or change of temperature. Here's a hormonal symphony. I love this diagram because when we're talking about the endocrine system, we're looking at different glands. For instance, from the beginning, or from the top, I should say, we're looking at the pineal gland, pituitary gland, hypothalamus. I remember my late anatomy professor, Dr. Patrick Watson, when he lectured about hypothalamus, he declared that God lives in hypothalamus. Well, I don't want to get into theological arguments, but it is a very, very, very important place that naturally regulates not only hormones, but also regulates body functions, regulates growth, metabolism, reproduction, and on and on and on and on. So that definitely a master hormone kind of influencer, if you wish. What are the hormones? Hormones are chemical messengers. I always kind of refer to hormones as little things that create a lot of change, little messengers, if you wish. So they travel to different tissues and organs. For instance, insulin release is under the hormonal kind of effect to affect glucose regulation, adrenaline, let's say, for stress response. Pituitary gland, on the other hand, is the master regulator, the thyroid, which modulates metabolism, adrenal glands, which produce stress hormones, pancreas, as I mentioned before, vital for blood regulation. So it's a harmony and it's a symphony. So as long as the symphony is in harmony, in medical terms, it's called homeostasis. In other words, everything seems to be in balance. Everything, your adrenal glands, your pancreas, your thymus, your thyroid, as well as parathyroid, all your glands are maintained in a state of well-being. Now, how the hormones affect the body process and how does that relate to temperature regulation per se? As I mentioned, hormones are chemical messengers. Let's say if we're looking at thyroid hormones, they will influence the metabolic rate, and therefore that will affect heat production. Remember, thermography is looking at heat that's being emitted from the surface of your body naturally. Hypothalamus is always, not always, but often termed a thermostat. Now, this thermostat can trigger various temperature regulating responses, sweating, shivering. So beyond thermal regulation, hormones, as I mentioned before, will affect growth, metabolism, reproduction, mood, organ function. So it's a very delicate balance, and once that balance is in a state of harmony, that's what we would call health. And once that balance is not in a state of harmony, there are very, very kind of dire consequences to that. Back to hypothalamus, um, it senses different temperatures, and it activates different mechanisms to correct whatever needs to be corrected. So if there is, let's say, excess heat, it invites sweating and vasodilation to disperse that heat. And conversely, if it's too cold, it triggers shivering and vasoconstriction to conserve heat. It modulates thyroid hormones. It's kind of a central kind of player in the endocrine system that not only looks at homeostasis, but it also can regulate hunger, thirst, sleep, circadian rhythm is affected. So as you can see, it's a very, very complex system that's very much connected to thermal regulation as well. Here we're looking at a conceptual illustration. So again, for those who are not really familiar with thermal imaging, I just wanted to kind of throw this up to show that different color variations and colors are affected by temperatures. So remember, cooler colors are generally lower temperatures, warmer colors are generally higher temperature. So instead of throwing a bunch of numbers that correspond to degrees in Celsius, what we have done here to illustrate the point is to create a color scale. So when we see hot spots, most likely that will indicate inflammation. When we see cool spots, that may indicate some form of reduced hormonal activity or hypo-functioning. So there is hyper and hypo-functioning in terms of temperature regulation. So in medicine, and I've seen this myself years ago when I was training a team in a clinic in Bogota, Colombia. A part of their actually a big part of their clinical kind of work was to do was dealing with artificial kind of insemination and um, kind of things associated with um, infertility, or I should say fertility probably is uh, a better term for this. They wanted to kind of to bring in thermal imaging to see as they're storing their eggs, can some of them will function, some of them will not function, and they wanted to see if it's possible to use thermal imaging to see which ones will actually give better results. It was a fascinating study. I don't think we ever actually completed that to the point where we can determine which eggs are going to be more productive. But in medicine, thermography can be, and in some cases is used to determine estrus as well as ovulation times. As we all know that ovulation times will affect a very, very kind of slight temperature variation. And naturally, we can detect that. So we can give better, precise kind of um, uh, clues to women that are using different types of applications in terms of when is their peak hormonal level in terms of ovulatory kind of timing. Naturally, we're also looking at breast health. This is something that I've spent, well, close to 25 years. I think this coming year is going to be 25 years observing and studying breast health. The picture on your left is a healthy breast. Things are um, in harmony. Everything is kind of there are no anomalies. Whereas the picture on the right, you can see that there's a lot more activity. There are irregular patterns, and these irregular patterns naturally will suggest that there is additional risk involved here as well. So this is something that we have been doing for a long time. As I said, I just wanted to kind of illustrate healthy versus unhealthy situation here. This is probably from one of our older reports. And with the advancement of thermal imaging in terms of breast cancer detection, I think everyone can see that the image of the right breast, which is on your left because it's this patient's anatomical right, the one with a lot of red, um, you're looking at huge difference in temperature variation between right and left breast. You can clearly see that with this particular color scale. And I just want to kind of move my cursor. So if we're looking at blue, that's going to be probably around 29 degrees Celsius. If we're looking at yellow, that's now 33 degrees Celsius. If we're looking at red, that's 34, 35 degrees. And anything over and above 36 degrees is going to start washing out to white. So the difference between this spot and this spot is about 6, 7 degrees difference. You can see clearly that even the difference between 2 points of reference between this nipple and this nipple is close to 6 degrees Celsius. That's huge. That's very, very significant. And naturally, this is going to be escalated very, very quickly. Now, not just breast, but we have been involved in what we call dental cranial thyroid imaging as well. And again, you can clearly see the difference between this image here and this image here. Naturally, these are not the same person. Sorry, we just wanted to move back here. Um, so here we have warming, here we have cooling. It's very easy to assess that. There are so many women that come to us and say, I keep asking my doctor to check the way my thyroid functions because I've been gaining weight recently. My skin is very dry. My hair is falling out. I can't sleep at night. I'm always cold. And yet, as they check just their TSH levels that happen to be within the so-called normal range, the symptoms are ignored. Here you can clearly see that the area over the thyroid is significantly cooler than the surrounding tissue, and it has to be the opposite. So it's quite easy to uncover this and escalate that this patient definitely needs additional testing. On the other hand, with warm thermal imaging over the thyroid area, we suspect thyroid nodules. In the majority of cases, these nodules are completely benign. Again, as long as they're warm nodules or hot nodules, as they're called, they're benign, but they're also indicative of some form of an imbalance, maybe an iodine deficiency. There are many different reasons, metabolic issues that can lead to thyroid nodules. So again, in many cases, these people are completely unaware of this. And yet, when we look at something like this, we'll bring it to their attention. We may ask them to have a thyroid ultrasound just to confirm. And unless there is a significant goiter condition, these are treatable conditions. You don't really need to take the thyroid out and have a radical thyroidectomy just because you have something like this. These are treatable conditions, and this person can get better with time, naturally. So this is where thermography really acts as a tool to diagnose and to kind of provide additional information, where in many cases, especially when it comes to nodules, they can be completely asymptomatic. And if you're not aware of it, well, naturally, you can't really address that. Um, Body heat, that's another one. This maybe is not the most extreme example, but again, if you look at this person's body heat, again, based on this particular color scale, this area here in the bottom of the breast, maybe 29 degrees, but let's say in the top, we're looking at skin surface temperature below 32 degrees Celsius. That's significantly lower than, let's say, 34, 35 degrees Celsius surface temperature of a woman, or even 33. What does that mean? It means that this person is functioning at a lower temperature level. In other words, if they get an infection and they need to spike a fever to get rid of that infection, which is a natural um, physiological response of the immune system, they cannot spike a fever that will be affected. Fever for them could be normal temperature. And yet, if we are generating a fever to fight a viral infection, it has to be 38 degrees and over, 38 degrees Celsius. They cannot get there because their thermostat is turned down to very, very kind of low. So whether it's a disorder of thyroid, whether disorder of other glands, we can investigate that when we see something like this. we will obviously bring this up to this patient or their practitioner's attention. Also, one thing I wanted to mention that during the menstrual cycle, the body temperature is generally lower in the follicular phase, and that's when the estrogen kind of is dominant. It will rise post post follicular phase, what we call the luteal phase, because of the influence of progesterone. Okay, a lot of people will call our office, or maybe other offices will ask the same question. Is there a better time for me to come? When is the best time for me to come during my menstrual cycle? And I always say that it really doesn't make that much of a difference, because if your temperature rises, let's say by 1 degree Celsius between day 25 and between day 5, it makes no difference to us because your temperature is going to rise symmetrically in your body, in your breast, in your shoulders, in your arms, and so on and so forth. So to us, it makes no difference because we always analyze things from right to left or left to right. It's always, we're always looking, if we're looking, let's say, in this particular case, as a breast analysis, we're looking at the contralateral comparison. So whether you're in day 5 or day 25, your body temperature may be slightly different, but your breast is not going to become abnormal, one breast, because of the difference in your cycle. As I mentioned, thermography can be and is often used in fertility and reproductive health. This kind of an illustration. And there are other applications. There's one that's called Natural Cycles that uses temperature data. When you use thermal imaging and you combine that with other applications, you're allowing kind of to optimize your chances, because you can get so accurate when you're using additional kind of information that you're getting from thermal imaging as well. Don't forget that because we're dealing with thermal regulation, naturally, inflammation is going to show up very quickly. So areas of inflammation are going to be hot. These areas are going to be identified for further investigation unless there is already kind of symptoms that are present. So anything abnormal in terms of temperature patterns will indicate increased blood flow to that area. And naturally, if there is increased blood flow, there is kind of additional metabolic activity, and that is usually associated with inflammation. Inflammation is huge. We spoke about this in previous lectures when it comes to musculoskeletal, when it comes to any kind of pain conditions. And naturally, thermal imaging can correlate hormonal changes with inflammatory responses. So this non-invasive way can monitor these conditions. There's one condition that I came across while I was preparing for this webinar is called thyroid eye disease. It's very rare, but it can be monitored with thermography based on temperature changes that where thyroid disease can affect your eye condition as well. So how do we assess heat in connection to hormones? Remember, hormones are playing a crucial role in regulating your body temperatures. Thyroid hormones, for instance, stimulate energy, heat productions within cells, and that influences your overall kind of body heat. estrogens have been found to affect your autonomic mechanism that will control the blood flow and sweating. So the key elements in heat kind of dissipation. And that's how heat is basically controlled by certain receptors in your skin, by vasodilation and vasoconstriction. So as many of you who are listening who have been through menopausal changes or are experiencing menopausal changes, definitely there is a hormonal effect that can lead to hot flashes, feelings of warmth, and that's a kind of a hormonal imbalance that's affecting your body's temperature control. You will also notice that when it comes to estrogen and progesterone, kind of the yin and yang kind of group here, we're also looking at estrogen is basically a cooling agent, and progesterone is basically a warming agent. Now, that's not to say that estrogen also has a vasodilation effect, especially when it comes to breast health. But generally, estrogens promote lower body temperature, whereas progesterones tend to rise the body temperature. Everything, of course, is under central control, but hormonal variations will affect your body temperature regulation. And again, this is where thermography comes in because we can measure it and we can, in a sense, what I would call visualize this as well. One more thing that when we talk about temperature regulation, we shouldn't forget about the adrenal effect. Feeling hot, hot, hot. Well, adrenals, as you know, are little kind of additional glands that are sitting on top of one's kidneys. And post-menopausal state, it is the adrenals that are going to be responsible for all your sex hormone production. Prior to that, in women, it's going to be your ovaries, in men is testes. So as your ovaries have gone to sleep, post-menopause, it's the adrenals. Now, the adrenals are funny little glands, but they're definitely kind of punching above their weight. They're small, but they are responsive for the fight and flight response. And because that fight and flight response, that also produces or the body basically secretes adrenaline and cortisol. It's very important, by the way, to check your cortisol levels as, for instance, saliva is probably one of the best ways to check your cortisol levels because you can do that over a 12 or a 24-hour period and see how your adrenals are functioning with relating to the cortisol. It's a very important kind of notion here because many of us are constantly under that fight and flight response. And it's the cortisol itself is going to affect the adrenal effect. If you have a high cortisol level, that's going to block or negate your progesterone production. So now you have become estrogen dominant. So as I said, it's a beautiful symphony when every player is playing the right tune, but it becomes a mess when something is out of tune. Just to the next one. I want to kind of bring up a couple of clinical cases and tell you about them. What I would call success stories. Now, some of them may not be kind of getting from worse to better. In this particular case, It's the other way around. So on the left, you see someone who came to us years ago. And you will notice that this is kind of everything seems to be within normal range. You're looking at a fairly symmetrical presentation. You're looking at nipple periareolar temperatures that are within normal range. 3 or 4 months later, the same woman comes in, and as you can see, there's something's up with the right breast, something very significant. Not only nipple and periareolar temperatures are way off, but you can see that the whole breast is actually swollen. Later on, we found out that actually, let me just come back and premise this. She went to her doctor who examined her and refused to send her for a mammogram because she was in her 40s at the time. Then she came to us. We confirmed that there is definitely some very, very high risk. Needless to say, she escalated. Luckily, this was an inflammatory breast cancer. This turned out to be phyllodes, which are in many cases benign. It's a benign condition, but as you can see, it's quite dramatic. And that's what I would call our success story, because we were able to confirm something that's quite obvious that led her to escalate and get proper treatment and diagnosis. In the next one, some of you may recognize this because I've used this in different presentations, also from many years ago. This wasn't a patient of mine. This was someone else's patient, where she came in on the left, on your left. You can see that there's a lot of activity in both breasts, fairly symmetrical, but left breast has a lot of asymmetry. When I say a lot of activity, you can see that both breasts are fairly kind of active in terms of thermal effect. This thermal effect is suspected to be estrogen dominance. She was put on a substance that's made from cruciferous vegetables called indole 3-carbinol, I3C. She used it for 6 months. There was no other kind of significant intervention in terms of her diet, in terms of any other possible variables. And the image on your right was taken 6 months later. Again, it's very, very dramatic. And that's how we can sometimes track not specifically the use of indole 3-carbinol or DIM or any other substance, but we can track many other kind of therapeutic interventions that will lead to improvement or not, depending on the result. Again, another what I would call kind of a success story, but in this particular case, someone who's moving from kind of medium to low risk to someone who has moved to high risk. Why would I call this a success story? Is because we caught it in time for this person to get help. This is what I call a blind spot. Sorry, let me just take another sip. It's even hard for me to listen to myself. What I call a blind spot, in this particular case, this woman between year 2007, 2010, happened to be taking bioidentical hormone called progesterone. In the majority of cases, it's well indicated. In the majority of cases, it's doing what it's supposed to do, balance the hormones, balance the kind of the lack of progesterone in many women's kind of health, starting from perimenopausal age through menopause and thereafter. But in this particular case, we're looking at progesterone that has been converting more to estrogen, and therefore you can see the effect on the left breast. The left breast is actually on your right because it's her anatomical left. So the effect over a period of 3 years was caught, luckily, because we didn't see anything in between. And luckily, we could see that she's not moving in the right direction. So her nipple areola temperatures are way off. So that's what I call the blind spot, because if you just measure your blood, or if you do a Dutch test or saliva test, it's not going to pick this up. The breast will metabolize hormones separately. Okay. In the majority of cases, yes, all these other tests will be, in a sense, in sync with the way your breast responds. But I find in my personal practice that about 10% of women, and this is not proven, but this is just my personal observation, that in about 10% of women that do just progesterone, in some cases, they will kind of have this effect. In other words, that progesterone is going to be aromatized into estrogen. Now, there may be different factors here. Maybe she is a fiend when it comes to coffee drinking. Maybe she's under a lot of stress. There are many other variables that will lead to this condition. So just by checking, as I said, blood or urine or saliva, you may miss it. So anyone who is doing a bioidentical hormone supplementation or replacement, I urge you to talk to your physicians, and I urge you to make sure that you are also monitored with thermography for your breast health, just in case you are one of those 10% of women that will aromatize progesterone into estrogen, and it's not going to be detected by other tests. Speaking about breast health, I want to kind of bring up something that also comes up in questions from different people, and I just want to make sure that it's addressed. There is a thing called Cold Challenge. Anyone who's been to our clinics, who's been to our affiliated clinics, understands that's what we do. That's what we have always been doing. Any reputable thermologist will insist on using a dynamic versus static thermography. What do I mean by dynamic? Dynamic means that it will involve several images over a period of time. So you will come in, you will do the first set of imaging, what we call a baseline. You will plunge your hands into cold water. You'll wait for 3 to 4 minutes. You'll get re-imaged again. And this is what we call the functional study. And why there is a difference, as you can see in this particular case, the nipple temperature here is 2.63. The nipple temperature here is 3.23. So if you plunge your hands into cold water, what is the effect? The effect is that you have to go into vasoconstriction versus vasodilation, okay? In other words, physiologically, this person is not responding correctly. And that gives us an additional clue that maybe something is wrong. So only by using dynamic thermography, you're increasing the chances of accuracy when it comes to breast assessment. There are common misconceptions. I just want to make sure that everybody kind of understands that thermography is not the latest panacea. We cannot detect or treat viruses. It's totally untrue. We can only measure skin temperature, and we do not diagnose or treat illness with our cameras. Thermal cameras cannot see into or below the surface. We are looking at skin kind of level. But keep one thing in mind, that anything inside has to come to the surface of the skin. So that's what we're assessing. Um, Now, all materials are emitting kind of measured equally. That's not true. Different materials emit different thermal energy. A stone will emit a different thermal energy, let's say, from a cat. A cat is much warmer than a stone. And I think, I'm just giving maybe silly examples, but, just to illustrate the point. Temperatures and color scales. Again, a lot of people will get a little kind of stuck on which colors are better. Is red better than blue? To me, it doesn't really matter. I can change the color scale that everything is in black and white. Darker is cooler, lighter is warmer. It's just for illustration purposes. We're using a thing called a rainbow, which is just much easier for people to understand. That's all there's to it. And thermal cameras do not see inside walls, just like we do not see inside people's bodies. Maybe there are some military applications that I've heard of that use some kind of thermal imagers that can see through walls. They're not in our possession. I wish they were, but they're not. So how does one enhance hormonal health? There are a couple of tips that I want to kind of to share. Very, very important is to maintain a proper body weight, because the body weight is going to, or excess, I should say, or will affect you on a hormonal level, right? So if you have a lot of adipose tissue, and that's fat in your belly, that's going to suppress the way your thyroid works. Once your thyroid is suppressed, you're going to gain more adipose tissue around your belly, and it's going to lead to a catch-22, a cycle that you don't want to get into. Eat plenty of healthy fats and plenty of fiber. Very important also to balance your kind of gut and your internal activity as well. Foods rich in calcium, vitamin D, bone health, very important, especially during menopausal changes. A lot of women will start losing calcium in their bone. Not necessarily osteoporosis. It's a different subject for maybe another lecture, but it's affected based on the hormonal change. Calcium is the after effect. Including phytoestrogens. Phytoestrogens are plant-based estrogens. Naturally, they're less harmful than xenoestrogens, which are industrial pollutants, things like that. So all of them will have an estrogenic effect. Some of them will have it mild, and some will have a horrible estrogenic effect. So check your cleaning products, check your food for xenoestrogens. Anything that you put on your body most likely will contain xenoestrogens. Your shampoo, your things that you apply on your face for wrinkle relief, these are highly estrogenic substances. Be very, very careful. And speaking about that, the most important thing that I see when I talk to patients is nobody checks their hormones unless you're taking bioidentical hormones. And even then, hormones are not properly checked. I can't say enough that this is the most important thing. If you take just one thing out of today's talk, please check your hormones. I hear this all the time. Well, my doctor does the usual kind of routine. Wouldn't they be checking my hormones? No, they're not going to be checking your hormones. They're checking your cholesterol. They're checking other things. Hormones generally are not checked unless you ask for it. Ask for it. Ask to be checked for estrogen, estradiol, progesterone, testosterone, the way your thyroid works, TSH, free T3, free T4, thyroid stimulating hormones naturally, and cortisol. Also check for thyroid antibodies as well. Because once, as I mentioned before, once if this is all in sync, you are most likely in a healthy state. If one of these are slightly out of bounds or very, very kind of low, you will start getting symptoms. And those symptoms can be treated and need to be addressed. And it's much, much easier to prevent things than to deal with things when the whole thing falls apart. So, in summary, a warm farewell to you. I decided to maybe kind of one thing that I want everyone to kind of understand, thermography is non-invasive, it's safe, it's patient-friendly, and it doesn't kind of affect you in terms of compression or radiation in any way. It's beneficial to women that have hormonal replacement therapy. Most of the women that come to us do bioidentical. Some probably require and still don't. But as I mentioned before, it's very important that you check your hormones on a regular basis. Thermography in this particular case provides a significant modality, not only for that, but through breast cancer screening, we can also detect who is most likely or suspiciously hormonally active. Let's say someone who is a woman in her 20s will have a certain breast pattern, which is different from a woman in her 60s. And when I see a lot of hormonal activity for a woman in her 50s or 60s, I suspect that they may be in some form of a hormonal influence. So it's very important to have this type of testing. Otherwise, again, if you're asymptomatic or even if you're symptomatic and your symptoms are ignored, it's not going to be helpful. It's an efficient tool. It's fairly economical. And as I said, I love sharing that with people because this is something that they understand because of it's visual and because we can understand certain things. It's much easier to explain to people. Now, since this is primarily addressed to other practitioners, I know we probably have more non-practitioners attending these webinars than practitioners. I just want to address all of the practitioners here that you need to incorporate thermography into your diagnostic tool for different reasons. Once again, there's no contact, there is no radiation. It leads to early detection, okay, before even things become symptomatic. It really is a holistic way of looking and assessing. I always say it's an extension of your physical exam. If you have a physical exam annually, you have to have an extension of that physical exam with thermal imaging. It complements other modalities. It does not replace anything else because it's unique, just like, let's say, mammography, ultrasound, MRI, CT scans are unique in their application as well. And it's suitable for many types of imaging, as I've mentioned here, specifically following kind of the subject of today's kind of discussion vis-a-vis hormones, it really is suitable to many different types of imaging. So, as I said, in summary, I just want to thank the Canadian Association of Clinical Thermography because our role is to establish thermography as a leading or key imaging tool in healthcare. If you have any questions, if you have um, any concerns, if you want to learn more, please contact us. You can go to our website, thermographycanada.com as well. If you want kind of a personal response, you're welcome to call us at the number that you see here. And finally, we're going to get a few minutes that we have maybe into a Q&A session.
Excellent. Thank you, Dr. Mostoy. Much appreciated. We do have a couple of questions. So for everybody else, if you have questions, please feel free to type them in the Q&A box and we will get to them. All right. So first question, you mentioned with thyroid that a patient presents with issues and the doctor tests TSH. This has happened to me. My concern is that in getting thermal imaging, my doctor may still dismiss the results. Do you have any advice with how to present thermography results to a doctor, or do you have any experience with this?
Yeah, it's very common. We're all down on something we're not up on. So your doc is not up on thermography, unfortunately. Maybe you can show him or her this particular webinar. Maybe you can just say, generally, as I said, you can dismiss things, but dismissing physiology, it's kind of very dangerous. So what I would say is that the body temperature is low. That's a significant symptom. My image is indicative of low or potentially hypothyroid. I don't see any issues by investigating this a little further, right?
Okay, thank
It
you.
doesn't have to be confrontational. It has to be more educational.
Mhm. Yeah, and just to follow up on that too, Dr. Mostoy, if you don't mind if I add, I know that I deal with that question a lot as well too, and a lot of women who will have, their thyroid, they have symptoms, it shows up in their thermography scan. I also make sure that I encourage them to seek out, naturopathic doctor or homeopathic doctor support as well too for that.
Mhm.
So if they want to go down, a different route, to also add that to their toolbox, because again, naturopathic and homeopathic doctors are also into the prevention, right? And proactiveness, whereas, medical doctors are trained in disease management and emergency healthcare. So a combination of the two is a good win-win situation.
For 3 or 4, I would encourage anyone, if you feel that you need additional help, keep looking and keep seeking. And, the patient is always right.
That's right. Absolutely. Know their bodies better than anybody else. Okay, this is just a housekeeping item, Dr. Mostovoy. The page with the adrenaline rush.
Mhm.
She's questioning where the kidneys with the adrenal glands are because it looks like it's in the chest. So
Yeah,
just
no, it's the image is not anatomically correct.
mhm,
I
perfect.
noticed that too, but it doesn't really matter. I just wanted to illustrate the adrenals, not
Mhm.
necessarily where they are in the body.
Yeah, thank you. Another question, please, would you repeat what hormones should we check regularly?
Would love to.
Yeah. And then also too, in addition to that, so Dr. Mostoy will repeat it now, but also what we'll do is when we send out the recording to you, we can put that as well in the bottom of the email. Okay. Go ahead, Dr.
Okay.
Mostoy.
Okay. So let's start with estrone, estradiol, progesterone, testosterone. We want to check TSH. We want to check free T3, free T4, and we want to check thyroid antibodies and TSH. We also want to check cortisol. Okay. Now, for women of menstruating age, I would suggest that you do that if we're checking blood, that you do your test between days 18 to 21. If you remember from this presentation, that's going to be in your luteal phase. Why we want to check that is because that's when progesterone is going to be rising. And if your progesterone is not rising at that age, that's indicative in many cases of perimenopause or menopausal state, where progesterone is being suppressed for different reasons. That's kind of the basic of, I mean, you can, again, you can go into LH, FSH, but to me, at this point in time, unless kind of certain symptoms indicate that, it's not that relevant to me personally. But in some conditions, you would need to add LH and FSH. That's kind of the basic of what we would call hormonal panel. That's blood. There is a urine test that a lot of people in holistic community will use called the Dutch test. It's also very comprehensive. It has kind of additional information that the blood test will not get. It's fairly expensive. But so for people who are on a limited budget, I always suggest try and get your blood test first. And if I don't want to say kind of money is no object, but if you can, you can definitely do the Dutch test. Then there is different tests that are also where you have to pay, and that's with saliva testing. Over the years, I didn't find saliva testing very accurate. That's my experience. I find that urine tests like Dutch tests is more accurate. However, if you have adrenal issues and if you are looking at cortisol levels, then saliva test is the best for that. Okay, because you can measure it over a period of time. Okay. Again, it all depends on your practitioner. It all depends on what they are comfortable with, on their clinical experience. So I'm just sharing it from my clinical experience. I'm not saying what's right and wrong. You're better off dealing with a person that knows your medical history and your case much better than I do. So I'm just sharing my opinion. That's all.
Thank you. All right, one last question. I know we're a little bit over time here, so we apologize. She's saying, I have a 24-year-old daughter who has a really extended cycle and can be really spread out. How could thermography track what is going on?
Well, first of all, again, if the cycle is extended, naturally you need to kind of check your hormones. Thermography in this particular case is not going to be tracking. Thermography in this particular case may be looking at what is the effect of this hormonal imbalance.
Mhm.
So if it's a very long cycle, how is it affecting your 24-year-old's breast? That would be my concern at this point in time. And as if things are corrected, great. If things are not corrected, how is it going to affect other parts of her body as well? That's where thermography can come in. But first, I would start with just general hormone testing first to see what needs to be kind of addressed and what needs to be tweaked first.
Thank you. All right, that concludes the questions for today. So we thank you for joining. And just one last housekeeping item. Our next session will be on March 20th. The information will be coming out within the week on how to register for that. And the topic is lymphatics and vascular health. So we look forward to presenting that to you again next month, March 20th. Thank you, everyone, for joining us today. Thank you, Dr. Mostovoy and the Canadian Association of Clinical Thermography. Have a wonderful day.
Thank you, Catherine. All the best.
The Canadian Association of Clinical Thermography is dedicated to making thermography more accessible and available to those who seek it. Become a supporting member today and help us transform the way medical thermography is understood in our world by practitioners and the general public. Visit us today and join us.